Hey, how you doing today? My name is Khdivstart, and I'm going to be your nurse for today. Today I'm going to be starting IV because I got in reports that you were having a lot of crackles and having problems putting out output, so for dehydration. First I'm going to provide you with some privacy. Make sure my bed is in good working position and my are locked. Um, Side rails are up. Could you please state your name and date of birth for me? Looking at your armband, Jack Smith, okay, 11558. All right, Mr. John Smith, do you have any allergies? Yes, I see on your MAR that you do have allergies to penicillin and aspirin. Okay. All right, Mr. Jack. We have orders today for 500 of saline. You're getting an antibiotic, which is called Khdivstart. I might be saying that wrong. Excuse me. And you're getting two Lasix, which is like a diuretic to help pass fluids out or increase the fluids, might I add. Okay. I'm going to wash my hands and I'm going to get my tourniquet to find a good vein. Do you have any contradiction on which side I can stick or anything? All right, you have a shunt in your on your left side, on your right side. Okay, so we're going to use your left side. All right, I'm going to check my supplies, checking expiration dates. Okay, everything is good. I'm going to open it. I'm going to put on my sterile gloves. Wash my hands. Place my tourniquet. Sorry if I'm lifting up your arms too hard. I'm putting it on the upper extremity and checking my distal area for great palpitation and great vein. All right, that's a big, good pulsation right there. So we're going to use that one. Is that okay, Mr. Jack? Yes, okay. And I'll check for pulse. Pulse is present. All right, I'm going to reduce my tourniquet. All right, Mr. Jack, I'm going to wash my hands at this moment and put on my sterile gloves. Again, checking my MAR to make sure it's the right patient. Jack Smith, 11558. Allergies to penicillin and aspirin. And again, Mr. Jack Smith, you're getting today normal saline 500 at a rate of 75 cc's an hour. You're getting an antibiotic at 475 milligrams every 6 hours, and then you're going to get your two diuretics I told you about, your furosemide. Okay, putting on my goggles, washing my hands, and I'm going to put on my sterile gloves. Okay, before I do that, sorry, wash my hands again. I'm going to apply my tourniquet so we can get that thing to pop up. Perfect things. Wash my hands. All right. My dominant hand is my right hand. Underneath. Okay. Making sure I don't cross my sterile field. Alrighty. You're going to clean your site to make sure we remove all germs, crackles. And we're going to clean for 30 seconds in a circular motion. Okay. My extension, I threw it away in my first video. So at this time, I'm going to connect my saline to my extension. the cap, aspirate. All right, connect to my extension. Insert saline into the line and remove all my air out of my line. All right. My cap is unscrewed on my extension. All right, and I'm gonna screw that back on. I'm gonna place those back into my pack so it can be sterile. At this point, I'm going to get my gel coat. I'm going to remove the top off my gel coat. All right, now, Mr. Jack, you're going to feel a pinch as I insert the catheter into your veins. I'm going to pull back to make sure everything is working properly. Going in at I think it was 10 to 15 degree angle. Checking for a flash. I have my flash. I'm going to get my gauze. Place it underneath there to catch any blood. Now, if I had my extension, I would insert my extension, making sure that I'm securing the catheter that's inside of the vein. I will now insert my extension, aspirate, flush. Okay? At this time, I'm going to apply my Tegaderm. Okay. The edges. And I'm going to save my edges to write the date, time, the catheter size. All right, Mr. Jack, I'm going to remove the tourniquet. The pulse is still present. Okay, I'm going to secure with tape. By chevron. Tape on the hook. And I'm going to chevron over. Your skin is so oily, Mr. Jack. Then the last one, I'm going to secure my flush. Alright, pulling back, aspirate on my flush to make sure we're still in. Alright, everything's good. Alright, Mr. Jack, you now have your IV in. I'm going to remove my sterile gloves, remove my goggles, and I'm going to wash my hands. I'm going to take this with me to the door, to the shops. All right, I'll be back. I'll be right back with your meds and my supplies. Okay. Use your call like you need to make sure your bed is still locked. The side rails are up. Okay. And I will be right back. And I'm going to document. I'm going to document the date and time, the size of the gel coat, how the patient tolerated in the site. All right. I will be right back.